The CDC and the World Health Organization advise against taking ibuprofen or Advil before getting the COVID-19 vaccine. Medical experts said it's because some studies show Advil or ibuprofen can reduce the number of antibodies. Dr. Sharon Mazumdar with Methodist Lebanon Health said there isn't much research on this, but it's better to be safe than sorry. There is a concern that these medications may blunt the immune response and perhaps make the vaccine less effective, said Dr. Mazumdar. Mazumdar says it's important to avoid pain relievers before getting the vaccine. The CDC and the WHO advise against it because it can reduce the number of antibodies that protect you from COVID-19. Basically, these medications, if you take them, you can potentially decrease that enzyme, decreasing the effect of the immune response, said Mazumdar. Mazumdar said even though there aren't many studies to support this, it's better to err on the side of caution. However, Dr. Mazumdar said if you feel sick after getting the vaccine, it's okay to take pain reliever medication. I think it's important for people to know that potentially these medications can impact their vaccine response, so I think the more information that's available for people, the better it is, said Mazumdar. Mazumdar said this shouldn't discourage people from getting the vaccine. She said getting the COVID-19 vaccine not only protects yourself but others as well. The vaccine is safe, she said. We have a lot of information, a lot of data now that shows it's safe and it's the best tool we have in fighting this pandemic, so I encourage everyone getting the vaccine when it's their turn. Dr. Mazumdar said if you accidentally take ibuprofen or Advil before getting the vaccine, it's not the end of the world because your body should be able to build an immune response. The CDC and the WHO are just warning against this because there isn't enough research on the matter. This article was originally written by Jacques Massé for Fox 13 on February 1, 2021. Volunteers needed at vaccination sites, an opportunity to help and get vaccinated yourself. More non-medical volunteers needed at San Diego vaccination sites. LA Mesa, Calif. Vaccination super sites are in need of volunteers, and Sharp Healthcare wants people to know there's only one requirement: a good attitude. Volunteers don't need a medical background. Organizers say it takes a village to vaccinate. Anything from registration, to wayfinding, to line management, and we even have folks that just create excitement and enthusiasm for patients that come in that are going to be vaccinated, said Jason Broad, Sharp's Vice President of Performance. Volunteers help staff multiple vaccination sites that Sharp is currently running. There's one in La Mesa, one in Chula Vista, one in Coronado, and soon to be one in the metro area, Broad said. Retired nurse Rosa Talon makes her drive to La Mesa all the way from Riverside 3 days a week because she said volunteering at an event like this is a once-in-a-lifetime opportunity. It's a long drive, but I always look forward to it, Talon said. She's not the only one traveling to help vaccination efforts. The need for vaccinators is so high that California leaders have loosened the criteria for those who administer the shots to include people from out of state. We are now accepting folks with an active license, also those who have an inactive license but have been active in the last 5 years in good standing, Broad said. While nursing student Isabella Santos isn't qualified to give shots, she said it is important to volunteer. She hopes to one day work at Sharp Mary Birch Hospital for Women and Newborns and said helping out with line management is a foot in the door. Getting vaccines to as many people as we can is so important right now, and having volunteers really helps the process go smoothly, Santos said. Volunteers are also eligible to get a vaccine. Sharp officials just ask that a volunteer commits to at least 3 shifts in order to qualify. Those interested can get more information and sign up through the Sharp Lends a Hand program. UC San Diego said it is also looking for volunteers for a new coronavirus vaccine site opening on campus on Monday. The site will serve eligible patients, faculty and staff. UCSD said volunteers will help with registration and be observers or runners at the site. This article was originally written by Ashley Jacobs for Fox 5 on February 6, 2021. U.S. coronavirus deaths surpass 450,000. The U.S. leads the world in both deaths and cases. More than 450,000 lives have been lost to the novel coronavirus in the U.S., estimates show. The country reached the grim milestone on Thursday evening, with data from Johns Hopkins University's Coronavirus Resource Center showing that some 456,461 lives have been lost as of Friday morning. Daily deaths remain high at more than 3,000 a day, estimates show. The U.S. leads the world in both deaths and cases, with the country recording nearly 27 million cases to date, according to Johns Hopkins University. The biggest driver to the U.S. death toll over the past month has been California, which has averaged more than 500 deaths per day in recent weeks. Alabama is another hot spot, with the 7-day rolling average of deaths rising over the past 2 weeks, from 74 to 147 deaths per day. Kentucky, North Carolina, Oklahoma, South Carolina and Tennessee have also seen recent surges in deaths. Infectious disease specialists expect deaths to start dropping soon after new cases hit a peak right around the beginning of the year. New COVID-19 deaths could ebb as early as next week, said the new director of the Centers for Disease Control and Prevention, Dr. Rochelle Walensky, who told the Associated Press that she's concerned about what effect Super Bowl gatherings this coming Sunday could have. Public health experts are watching Florida closely this week as the Super Bowl will be played in Tampa. City leaders and the NFL are trying to ensure social distancing by capping attendance at a third of the stadium's capacity, 22,000 people. Still, there will be parties, events at bars and clubs, and other activities that draw people together. Earlier this week, the nation's top infectious disease expert, Dr. Anthony Fauci, pleaded with NFL fans watching the Tampa Bay Buccaneers and the Kansas City Chiefs face off to only do so with your family or with people that are in your household. He noted that every time the nation celebrates a holiday or occasion, a spike in coronavirus cases follows. As much fun as it is to get together in a big Super Bowl party, now is not the time to do that, Fauci said Wednesday while appearing on Today. Watch the game and enjoy it, but do it with your family or with people in your household. Fox News' Alexandria Hein and the Associated Press contributed to this report. This article was originally written by Madeleine Farber for Fox News on February 1, 2021.